Welcome everybody to this month's installment of the Ortho-Minute, or Orthopedic Minute. I hope everybody had a Merry Christmas and a Happy New Year, and that all is going well. Today we're going to go ahead and talk about fractures of bones. To start, the adult body has a little over 200 bones. The pediatric body has quite a bit more than that, and as you can tell, there's going to be a big difference there. When it comes to bone structure in a child per se, the bones are a little more flexible. They're still in a growing state, have the ability to remodel themselves quite a bit. In an adult, they're not so much flexible. In a case where a child would fall and bounce, an adult can fall and break several things. And the way we treat those fractures is going to be a little bit different as well. In a child, we do everything in our power not to do surgery. In an adult, we don't necessarily have that luxury, because if we don't get it where it needs to be and stabilize it, it's not going to heal correctly. And so today I would like to talk about one of the more common pediatric fractures, and that is called a buccal fracture or a green stick fracture. And I have a picture that I'd like to show you. So this is just an animation or a drawing of some bones in the body. Of course, this is the hand and this is the forearm. And when you have a green stick fracture, you think of a green branch on a tree versus a dead branch on a tree. When you try to bend a green branch, it just kind of bends and can splinter a little bit. A dead branch obviously just breaks really easy, and that's the same way with pediatric bones. Sometimes when you fall as a pediatric or a little kid, the bone doesn't break completely, and that's what we call a green stick fracture. You can see here, this is representing where the fracture is. A little zoomed up here, you can see there's some splintering and fracture on one side. On the other side, there's a little bulge. And that's very typical of what a green stick or a buccal fracture is. This is one of the most common types of fractures we see in kids, and that's why I've chosen to talk about it today. I also would like to talk about briefly, there's a lot of different types of fractures. It's not one or two types, there's several. And this picture represents that a little bit. We have transverse fractures, which is just a crack or a break right across. Linear is a fracture down the length of the bone. Oftentimes when you go to the ER or to the hospital and you hear about an oblique fracture, what that means is it's just not an easy straight across fracture. It's one that kind of travels more of a longitudinal and horizontal type of a fracture. When the break is clean through and it displaces or moves so the two ends aren't lined up, that's called an oblique fracture. A spiral fracture is almost like a spring or a coil. The fracture coils around the bone a little bit. And then here's the representation of the green stick fracture. And then you'll also hear comminuted. Comminuted is kind of like several pieces, not so straightforward. Here is an actual x-ray of what a green stick fracture looks like. You can kind of see here, this bone is not in a natural curvature, and that's often one of the more classical signs of a green stick fracture. Recently we had a young man come to our hospital with a pretty severe forearm fracture, so we're going to talk about his case. Before we do that, I want to point out, on x-rays in kids, you're oftentimes going to see this little section of the bone right here. Oftentimes that gets confused with a fracture. This is what we call the growth plate or the epiphyseal plate, and that growth plate is where all of the growth in the bones happens. And so we expect to see this, and there's very little concern for fractures at these sites when we have no symptoms related to the side of the growth plates. So this young man came to our hospital. Obviously he had a fall. He was jumping on some furniture, fell off, and broke his arm. And I could imagine as a parent that would be very nerve-wracking and unsettling. They took him to the emergency room, and this is the x-ray that they took. And he's again got breaks in two different bones in the forearm. The emergency room doctor in this case was able to with the help of anesthesia so that the young kid would not feel it, was able to move the bones back in a relatively good position. You can see here these bones do not follow necessarily a natural curvature of the bone, but they are a lot better than previously. So in this type of a case, the bones were still not acceptable, so he was sent home in a splint and then followed up with us in clinic, and then we determined that we would like to again move these bones to a better position. And so he was taken to our operating room, not for surgery, but so in a sterile environment where we had very good control with our anesthesia providers and the monitoring equipment. We put him asleep again, where we were able to take x-rays as we tried to put this bone back where it needs to belong. And this is the picture in the operating room after we had the bone placed where it needs to be with the cast in place, and it's near anatomical, meaning it's almost where it would be found naturally. So the work's not done yet. After we get the bones put where they need to be, a lot of things can happen. In the cast can loosen a little bit as swelling goes down. The kid could fall again and the bones could move, and so we have to follow this type of fracture frequently. And frequently is about every week after we have a fracture like this, we want to x-ray the patient. I like to get my eyes on them and look at their symptoms, make sure that they've got no complications with this cast, because those bones can move and will move if we're not careful. And so after this patient was taken to our operating room and we got the bones exactly where we wanted them, he was followed up with on a weekly basis. I want to show you one of his subsequent x-rays. So here you can see this is an x-ray through the cast material, and the bones looked very good, and then you can start to see here a little, almost what looks like a knot on a tree growing on that bone. And that is the good healing that we like to see in these type of pediatric fractures. And then ultimately, after 6 weeks of being in the cast, we removed the cast, took another x-ray, and you can see here there's quite a bit of good bone remodeling, which will happen in pediatrics, small kids. And this kid was able to go home without a cast, and at first he's going to be a little stiff in flexion and extension of the elbow, as well as moving the wrist back and forth. But as he uses this should heal just fine. About a year from now, I would expect to be able to take a picture and these bones are going to look almost like nothing ever happened. And that's the luxury that children afford us, is that they heal well as long as we get things near where they should be. This is just one example of a fracture that happened in a pediatric arm. Typically, when we are dealing with fractures, we have to consider several options. One is, can we rest the fracture? Meaning, if it's in an arm, we can usually put them in a cast, and the patient won't need to use that arm, and that would put at risk of those bones moving. If it's in a foot or a leg or a knee or a thigh, that's not as easy because people need to walk. And so that's why oftentimes you will see different sorts of casts in lower extremities, and those casts are designed to allow the bone to heal without any weight or any movement in those bones. Whereas in the arms and wrist and hand, that's a little bit easier to treat because it's a lot easier to rest that joint. This is just scratching the surface with pediatric fractures, but it's one of the more common ones we see, so I wanted to kind of introduce the topic of fractures, why we sometimes have to take patients to an operating room to get the fracture where we need to, why sometimes they don't need to do that, as well as why sometimes we have to do x-rays, oftentimes every week for 3 weeks, and that is mainly to make sure that the bone is healing, it hasn't moved, and it's staying where we need it to. And so be careful out there on the ice. This is that time of year, and if you fall and get hurt, please come and see us.